Hello, and welcome to another episode of How to Survive Healthcare. I'm your host, Kayla Thompson-Riviere, registered nurse and independent patient advocate. As always, any information you hear on this podcast is not a substitute for medical advice and is only meant to inform and entertain. So, today I want to talk to you a little bit about how to make your medical records work for you. As most anything in the healthcare system, medical records are probably not as straightforward as you think they should be. The healthcare system has always been fragmented by physicians and individual healthcare networks. It has gotten more comprehensive over time. It used to be that physicians each worked for themselves and the hospitals were all separate, and medical record sharing was actually much more difficult before. It has gotten better with the advent of technology, but it's probably not at the point where you expect it to be. The reason I say this is I've had tons of people over the years, patients while working as a nurse, tell me, oh, well, that's in my record. Oh, they should be able to see that. Oh, I didn't tell the doctor about that because I already saw a doctor for that, or that kind of sentiment over and over. The thing is, although all that information is in a healthcare record somewhere, healthcare records are not very intuitive or user-friendly. It actually tends to be an issue of over-information. For instance, when you go to see a doctor and they write a note about your appointment, the piece of the narrative that kind of tells the story about your appointment and why you were there that day is maybe only about a paragraph long, but there's so many other things that for billing and just kind of CYA regulations, there's so many other things that get attached into that note that it almost becomes looking for a needle in a haystack, trying to tease out this information. So in addition to that, it is not always organized in a logical fashion. Furthermore, if you're seeing multiple physicians across different hospital systems, those records almost never talk to each other. So even though, it is in a record somewhere, your doctor's not going to have access to it unless they know to go looking for it and specifically request that. So all of that being said, I really strongly encourage you to take your healthcare records into your own hands. So that's very overwhelming. The best place to start with that is by downloading my Health Hub. It's a free resource and it gives you a one-page overview of all of your physicians, all your medications, your medical conditions, and your baseline functioning status. So a really good snapshot of the most pertinent details of your health. That, however, isn't going to be a substitute for a comprehensive medical record, especially if you do have a complex, rare, or pretty significant ongoing medical condition. You're really going to want to keep a detailed record of your own. So I recommend doing this. Either you can do it on your computer or old school in a binder. I think it makes sense to do both, to have things organized on your computer so that you can go through and update things as conditions change and progress, but then also to have that printed out and in a physical binder so that when you are seeing new physicians or if you're traveling, it's something that can come with you, and no matter what situation you're in, you're going to have your health information right there with you. So in order to do that, it's going to be a very big undertaking. You will want to set aside quite a bit of time for this. Again, it depends on the length and significance of your medical history, but if you've had a lot of complicated things going on, it's going to take some time. That being said, the more complicated your health history is, the more important it is for you to be doing this. So first of all, you'll go into your health portals and pull out all the information you can. Notes from previous doctor's visits, lab results, CAT scan, ultrasound testing results, operative reports, anything that's been done to you or that you've seen somebody for, you want to get the record for. Fortunately, that can mostly be found online in your health portal. If there's something you had done that you can't locate, call the office or that hospital and ask for medical records and get to that information and have it sent to you. Sometimes there is a small fee attached to that, but it's typically no more than a few dollars. In addition, any kind of imaging studies you've had done, x-rays, CAT scans, MRIs, anything, you want the report, but even more so, you want to request the physical disc of that study. The reason is that the report is basically just a summary of what the radiologist thinks from looking at it. However, radiologists, just like any other human being, are fallible and things get missed. And oftentimes physicians, particularly surgeons, like to actually look at the images themselves and be able to either corroborate what the radiologist is seeing, or there's been many times I've seen where that second set of eyes then see something else on that image that was missed the first time. And sometimes it's not little things either. So particularly if you're getting a second opinion, always have your images with you. This can actually help you avoid having to get subsequent repeat scans if they're really just looking for those images. So once you gather all of your data, you want to start creating yourself a chronological timeline. And chronological meaning, starting in the beginning when your health condition started, and then the doctors that you saw for that and the things that were done for that. Ideally, for each entry on your timeline, you want to have pages that are going to coordinate with it. So, I saw Dr. Jones on this day, and on page 21 is where you can see the note from that visit. Again, this is where it can take a lot of time to get all of it detailed. But I'm telling you, when you go to see new providers, or again, if you are trying to go and get a second opinion, it's going to make all the difference in getting your care figured out, and for them to be able to understand very efficiently what has been going on with you and what your path has been like. So I really encourage you taking the time to do this. You'll want to have sections for all those diagnostic studies, notes from the appointments, care plans that the doctors have come up with, surgical records, and perhaps even a section for your personal health goals, so that any of the physicians that are working with you understand where you've been, where you're at now, where you're trying to get to, what's already been tried, and whatnot. If this is something that does sound overwhelming to you, but you know that you need to get it done, this is something that I can help you with. Please reach out on our website, heardforlife.com. That's HEARDFORLIFE.com. Or you can find me on Facebook or Instagram, and we can talk about getting some appointments set up so that we can discuss your history, and I can get this all put together for you so that you have a complete record at your fingertips, ready for going to a different doctor, a different hospital system, or pursuing that second opinion. So I hope that this was so helpful for you. Again, if at any time there is a topic that you wish you knew more about, or you'd like to see a podcast on, please don't hesitate to reach out about that, and I'll be happy to try to get it on the show. Thank you so much. Have a great day.